Hey there, future healthcare professionals. Today, I'm diving into an essential aspect of pediatric health nutritional assessment. Let's get started. First up, we're talking about height, weight, and BMI. Measuring a child's height or length helps evaluate growth. For instance, if a 4-year-old is significantly shorter than their peers, this could be a red flag for chronic malnutrition or endocrine disorders. Next, weight. Weight is assessed relative to age and height. A 2-year-old who hasn't gained weight over several months might be at risk of failure to thrive. BMI, calculated using height and weight, helps determine if a child is underweight, normal weight, overweight, or obese. For example, a 7-year-old with a BMI in the 95th percentile may be classified as obese, necessitating lifestyle changes. Moving on to, for infants, understanding whether they are breastfed, formula-fed, or mixed-fed is crucial. A 6-month-old exclusively breastfed but showing signs of iron deficiency might need dietary supplementation. The timing and type of solid foods introduced to infants and toddlers are also significant. A 10-month-old who hasn't been introduced to iron-rich foods like fortified cereals might be at risk for iron deficiency anemia. For older children, assess meal patterns, variety, and portion sizes. A 5-year-old consuming a diet high in processed foods and low in fruits and vegetables could be at risk for micronutrient deficiencies. Now let's talk about, look for signs of nutritional deficiencies like dry skin, brittle hair, or spoon-shaped nails. A child with pale conjunctiva and brittle nails might have iron deficiency anemia. Evaluate muscle mass and fat stores. Visible ribs and thin extremities may indicate protein-calorie malnutrition. Don't forget to check developmental milestones. Delays could indicate chronic undernutrition or specific nutrient deficiencies. Then there are hemoglobin and hematocrit levels help detect anemia. For example, a child with low hemoglobin might need iron supplementation. Serum albumin and prealbumin assess protein status. Low prealbumin levels might indicate protein energy malnutrition. Micronutrient levels like vitamin D, B12, calcium, and zinc help identify specific deficiencies. A child with low vitamin D levels might need supplementation, and more sunlight exposure is crucial. Pediatric growth charts compare a child's growth parameters to standardized norms. A 3-year-old boy consistently below the 3rd percentile for weight might need further evaluation. Analyzing dietary intake against age-appropriate guidelines helps identify nutritional gaps. A 6-year-old consuming less than the recommended dairy servings might be at risk for calcium and vitamin D deficiencies. Let's wrap it up with consider a 2-year-old girl with poor growth concerns. She's in the 10th percentile for weight and 5th for height, with a dietary history of being a picky eater. Physical examination shows pale skin and thin hair. Laboratory tests reveal low hemoglobin, indicating anemia. The pediatrician might recommend a diet with a broader range of foods, particularly those rich in iron. Iron supplementation could be prescribed, and her growth and nutritional status would be closely monitored. So there you have it. A thorough nutritional assessment is vital for identifying and addressing potential health issues in kids. By evaluating anthropometric data, dietary intake, physical signs, and lab results, we can support a child's growth and development effectively. Thanks for watching, and keep those little ones healthy.